Good afternoon. I will call the House Higher Education Committee to order. I'll note for the record that a quorum is established. And Representative Novotny, would you move the minutes from February 20th for approval?
I have.
Thank you. So Representative Novotny moves the minutes for approval for February the 20th. Any discussion? Okay, seeing. So I'll reestablish that we do have quorum. We had a member that stopped in and he just stepped out and he'll be right back. So that makes it quorum. So any other discussion about the minutes? Okay, all in favor say aye. Opposed say nay. Motion prevails, minutes are approved. Okay, now to our esteemed guest today. And we have back the University of Minnesota for the second full day. Dr. Rebecca Cunningham is here. Dr. President Rebecca Cunningham is here, and I will turn it over to you and your wonderful team of several folks that will be presenting today. President Cunningham.
Thank you, Madam Chair and members of the committee. Thank you for the opportunity to come back today and present on an issue that is certainly near and dear to my heart, the health and wellness of all Minnesotans. Before I joined the university as its 18th president, I spent 25 years as an emergency physician, taking care of patients at the bedside. And it's actually wonderful to see the nurses here today alongside many wonderful nursing partner colleagues, working with communities to keep children and families safe and serving in leadership positions at university medical centers. So I tend to see the world through a healthcare lens in the broadest possible sense. I'm now halfway through my first year as president. And during this time, I've had the distinct pleasure of engaging with Minnesotans across all 87 counties. Through these conversations, one thing is crystal clear. People are looking to the University of Minnesota to find solutions for their greatest challenges surrounding their health. As president, I can assure you we will answer their call. As one of America's leading public research universities, we have a responsibility to all of the people of Minnesota to generate new knowledge, to train our future workforce, including our healthcare workforce, to develop new innovations, to drive economic growth, and most importantly, to improve the health, again, of all Minnesotans. But right now, we are at an inflection point. Our state, like countless others across the country, faces many key healthcare challenges, from increasing costs, limited access, and declining reimbursements, to workforce shortages, structural inequalities that amplify health disparities. Minnesotans have said loud and clear that healthcare needs to work better for them and for their family. We hear you and we agree. This is why we're proposing a new path forward. As many of you know, the University of Minnesota and Essentia Health have come together to chart a bold new solution for the future of healthcare in our state. A new non-for-profit healthcare entity system that combines our people, systems, capabilities, and expertise to deliver a new level of seamless, expanded healthcare across Minnesota. Our focus is on a transformational change. We cannot have incremental change. We need to have transformational change so that together we can overcome the greatest healthcare challenges impacting our state. It's our responsibility and our commitment to improve the health of all Minnesotans, not a structure or to continue a contract focused on aging buildings and faceless transactions. The University of Minnesota and Essentia Health agree there are real advantages associated with a larger scale and more capable organization and how it could benefit patients, nurses, physicians, and caregivers statewide. There is urgency for us to find a new solution now, one that ensures our commitment to health and the healthcare professional education is sustained and thrives well into the future. The university's existing agreements with Fairview expire at the end of 2026, which means they need to be worked on immediately. Without a solution, the impact felt by patients, nurses, caregivers across Minnesota will be significant and far-reaching and deep. The healthcare workforce pipeline that originates and is rooted at the University of Minnesota would be affected in profound ways without this solution. Think reduced class size, reduced residency and fellowship programs, less well-trained nurses and physicians to practice outside urban areas. The University of Minnesota is a global leader in research and discovery, ranking 12th nationally in total research volume. Think our med tech industry. But without a new solution that we propose, there would most certainly be detrimental impacts on our ability to catalyze and support and safeguard our research moving forward. Expanding our services in communities that have growing healthcare needs would also be impacted. Our ability to grow in areas like Duluth, St. Cloud would present even greater challenges. Without a new solution, the Fairview-owned facilities on the East and West Bank that we train and provide care in will continue to deteriorate, inhibiting our ability to deliver high-quality, patient-centered care for our students, for our patients, for nurses, doctors, and caregivers, and for Minnesotans broadly. So now is the time for us to put ego aside and come together to build a bold, shared solution that best meets the needs of our state. In the presentations that follow, you will learn more about the university's unwavering commitment to Minnesota. You will also learn about the vast potential that comes from increased state investment. Without a solution that sustains our health and medical education commitment, those results, and more importantly, these possibilities that we'll present to you today, are all at risk. And so as we move forward, as Minnesotans' only public institution, your only public medical school, your only vet school, your only dental school in the state, we remain intensely focused on supporting health and needs of everyone across the state. The university's commitment to build a brighter future for Minnesota is reflected in our latest state budget proposal. With state support, the university can help solve the growing healthcare crisis in rural, tribal, and underserved communities across Minnesota. We can expand access to care and reduce staffing shortages. We can increase the state's workforce by 3,000 health professionals over the next decade and every decade after. We can support clinical placements for our students in every corner of the state, decreasing the difficulties in access across the state. And we can triple the number of mobile health and telehealth services across Minnesota by working with local providers in hospitals to deliver those, serving 6,000 more patients a year. So why is in-state support so essential for the healthcare provider workforce mission? For starters, state investment in academic health is not just about education. It's about ensuring the health, wellness, safety, quality of life, and prosperity of people and communities across Minnesota, including the economic development of local communities that need health care in their communities. It's about strengthening our workforce from Austin to International Falls and everywhere in between. And it's about creating new medical innovations that reduce illness and save lives. The long-term success of our university has a direct impact on every single person sitting here in this room, because we depend on the nurses, the caregivers who train at the university, who choose to provide care in our communities. About 70% of all Minnesota physicians that you are likely seeing across the state, no matter what health system you are working with, were trained at the University of Minnesota Medical School. With your partnership, we can expand access, reduce inequalities, transform healthcare for generations to come. So thank you for your time today. I would now like to turn it over to my colleagues who can provide more details about our health sciences specific budget request, overview, strategic plan, and legislative request. Before I get into that, I do want to remind folks the initial new path forward that I talked about with Essentia does not have a state ask. That is a proposed solution that we are bringing $1 billion to the table for the state of Minnesota to create that new health system entity, and we are not asking taxpayer support for that. But we do have a health sciences budget request for workforce, and for that, we'll talk more about that today. Thank you.
And President Cunningham, before we move forward, I was just wondering if you could give us kind of the update as to what's happening with Fairview and the Essentia Health plan moving forward.
We continue to work towards Essentia and the university, and many people across our communities continue to believe that this solution that we're proposing forward will provide the best future health care for the state, and that the alternative, which I started to lay out here, would have tremendously detrimental effects on the state. And so we're continuing the work across our communities and our stakeholders on those conversations. We look forward to more conversations with our Fairview partners. Thank you.
Thank you, President Cunningham. So when you arrive at a deal that is agreed to by all, you'll come back and let us know what that deal is?
Certainly happy to do that. Happy to have conversations at any time.
Wonderful. Thank you, President. And please introduce yourself for the committee and continue with your testimony.
Madam Chair and members of the committee, it's a pleasure to be with you today. My name is Bill Siebert. I'm the Senior Associate Dean and Chief Financial Officer of the Medical School and also the Chief Financial Officer of University of Minnesota Physicians. Trying to advance the slides, of course.
Maybe the arrow.
Okay, there we go. As Ms. Tonneson mentioned last week, this slide articulates the major academic units' actual revenues. The units marked with an asterisk and featuring toggle titles represent the 6 colleges and schools that comprise the Health Sciences Division. Additionally, the slide includes the Office of Academic Clinical Affairs, as it also receives state funding. I will be addressing the medical school only. If we were to look at the medical school revenues from a different lens, we would find the following. Faculty clinical practice is approximately 53% of the total, which is $518 million approximately. Federal government, grants and contracts, 30%, approximately $296 million. O&M, 10%, $96 million. Tuition, 3%, $30 million. Gifts, 2.5%, 3%. $25 million and other $2 million for a total of $283 million. Just wanted to give a different perspective than this slide actually shows. O&M appropriation is the glue, it really is for us. These O&M funds are utilized to support operations in the medical school departments and the dean's office. They're used for faculty, staff, educational support and programming, for example, admissions, student affairs, and these are the amounts that are not covered by tuition. We have a well-defined, transparent approach to budgeting within the medical school. All fund sources such as O&M, clinical practice revenue, and research support revenue are considered in creating an academic funds flow. These funds flow to the departments based on the department size, their role in core mission activities, and their accomplishments. We're purposeful to match funding sources to the related programmatic areas. For example, clinical services funds only come from the funds we receive from our clinical partners. State specials are utilized as directed. For example, I can get closer. Medicare and tobacco funds are used to fund education such as simulation programming and education faculty salaries. About 2/3 of O&M is used to cover the remaining faculty, staff, and operational costs not covered by the aforementioned sources. The funding that is left over is used to fund the dean's office operations. The dean's office goes through a rigorous annual budgeting process that includes a review of staffing plans, impact of programming, satisfaction of students, and achievement of goals that have been established on a function-by-function basis.
President Cunningham.
If I could add one thing here with apologies for interrupting you, because I don't know that everybody understands necessarily. When we say facility operations here, we're talking about the university, basically classroom facility and classroom training facilities. I just want to distinguish that in people's mind from the hospital buildings where clinical practice happens, which we do not own. And those are the ones I spoke of as needing a substantial investment and repair that has not been done to date. What we're talking about here are the facility operations of our classroom buildings and our training facilities for the first beginning parts of medical students, for example. I just wanted to help that conversation.
That's an essential differentiation. Thank you.
Thank you, President. Mr. Siebert.
Madam Chair and members, before I hand this over to my colleague, Dr. Crawford, I want to highlight that throughout this presentation, we're referencing the final bill language and spreadsheet from the 2023 legislative session, which are included in your package. Since no additional funding was allocated in 2024 and no changes were made to the riders in 2024, except for the Central Care appropriation, which Dr. Crawford will address in his remarks, these documents remain our primary reference. Thank you very much for your time.
Dr. Crawford, welcome to the committee. Please state your name for the record and continue with your testimony.
Madam Chair and members, it's a privilege to return to the community today. For the record, my name is Peter Crawford, and I serve as Vice Dean for Research for the Medical School at the University of Minnesota. And if I may, maybe I'll switch over to the computer so that I can use the slides. The first of the two riders that I will discuss with you today are directly appropriated to the medical school for two items, the medical discovery teams and the healthcare training restoration programs. The first is the medical discovery teams, $15 million in fiscal year 24 and $15 million in fiscal year 25 are to increase the medical school's research capacity, to improve the medical school's ranking in National Institutes of Health funding, to ensure the medical school's national prominence by attracting and retaining world-class faculty, staff, and students, to invest in physician training programs in rural and underserved communities in the state, and to translate the medical school's research discoveries into new treatments and cures to improve the health of Minnesotans. This is a fortification provision that we value very highly. And one representation of the success of these programs is that 5 of our medical school departments are ranked within the top 10 for National Institutes of Health funding in the United States, including our family medicine program, which is ranked #1 in the country by a $15 million margin. This engine of innovation serves the wellness of Minnesotans and obviously is a key cog in workforce development. The second rider is the healthcare training restoration. $7.8 million allocation in fiscal year 24 and $7.8 in fiscal year 25 are for health training restoration. This appropriation is used to support all of the following. Faculty physicians who teach at 8 residency program sites, including medical resident and student training in the Department of Family Medicine. The funds to the Department of Family Medicine are almost entirely used for people, for those trainers. Second, the mobile dental clinic. The mobile dental clinic is a vital community health initiative that provides accessible, high-quality dental care to underserved populations across both the metro and rural areas in Minnesota. The mobile dental clinic serves individuals insured through Medicaid and Medicare, as well as patients with special health care needs, bridging the gap in dental care accessibility for communities with limited provider opportunities. The University of Minnesota School of Dentistry is one of the only dental schools in the country with this kind of model of care. Third, under the healthcare training restoration allocation is the expansion of geriatric education and family programs. The state's investment in geriatrics has led to the university being awarded an $8.5 million grant for geriatrics workforce education development, which provides interprofessional geriatric clinical training to students, residents, fellows, and faculty preceptors across the state to improve the health and the health care of older individuals, including persons living with dementia. A third allocation is the Center Care Campus program, which is a one-time allocation. Center Care, in 2023, the legislature appropriated to the university $10 million for the new Center Care Regional Campus in St. Cloud. Given that the appropriation expires in fiscal year 27, and the campus would not welcome its first class until this year, which is well on its way, that procession for an August matriculation, we asked the legislature to change the language in 2024, and since then have budgeted the funding, including for key personnel, information technology infrastructure, including the admissions software, scholarships for the incoming class of 2025. The Center Care Regional Campus is due to welcome its first class of 24 students in August of this year. We had over 250 applicants rank St. Cloud as their first choice and have already begun seating the inaugural class. Center Care has been a phenomenal partner. Without them, this campus would not be possible.
Dr. Crawford, we have a question from Lead Wolgamont.
Well, thank you so much, Madam Chair. Thank you, Dr. Crawford. Madam President, welcome back to higher ed. Again, we appreciate your presence here and giving us this information, and the accountability really means a lot. Madam Chair, I don't have a question, but I would just like to underscore for the committee the importance of this appropriation as we seek to tackle the healthcare workforce crisis that we're facing in greater Minnesota. Couple of numbers for members of the community to consider. In the United States, 20% of the U.S. population lives in rural areas, while only 11% of physicians practice in rural areas. And this discrepancy has real consequences, Madam Chair. People living in rural areas face longer waiting times for their medical care. They have to travel farther to access care. And as a result, unfortunately, we're seeing poorer health outcomes for people living in rural areas than do people living in urban areas. I'm proud that our committee has made this investment in the University of Minnesota Medical School campus on the CentraCare Health System. And it's so exciting that, as Dr. Crawford said, in 2025, they're set to enroll somewhere between 20 to 24 students. And as this progresses, the goal will be to have about 80 to 96 students per year. This is direct action that we can take to invest in our constituents in Greater Minnesota and make sure that they're getting the health care that they need, to make sure that nobody's care is determined by where their zip code is, but that we're stepping up and doing our part and having people get good coverage in every corner of the state. So thank you, Madam Chair, and thank you, members, for your past support for this appropriation. And we look forward to doing our part on the Higher Education Committee to continue the good work happening in Greater Minnesota healthcare through this medical school. Thank you, Madam Chair.
Thank you, League Wogelmont. And I'm very glad that it's not in an endowment, so they can actually use the money to do the project. So I'm very glad that we did that change too, and it made it all the way through to the very end, which does not always happen.
Madam Chair, we thank you for your help in making sure that we got that language right, and we will continue as we proceed to not include the word endowment. Thanks to your wisdom and guidance, Madam Chair.
Thank you, Lead Wogelmont. Yeah, it would have hindered their ability to do what they really wanted to do. So I'm glad we worked collaboratively. But Dr. Crawford, please continue and tell us about the good work that you've been doing at the CentraCare facility.
Madam Chair, President Cunningham would like to make a remark.
Oh,
It's
yes,
acceptable to the
Dr.
chair.
Cunningham.
Thank you, Madam Chair. And I really appreciate the acknowledgement of the tremendous work that the team in the medical school has done to be able to support rural care, especially in this great advancement here in St. Cloud. I just cannot emphasize enough to the committee that that is the kind of work that will not be able to continue if we do not find the correct path forward for our medical school. It is one medical school. We have different sites in different places in the state. One of them is Duluth, one of them is St. Cloud. Right now is the expansion. We cannot expand or continue to maintain that sort of work if our core functions are completely detrimentally cut back. And if that happens, then we will decrease class sizes, we will have less residency options, we will have to constrict to our core functions, and we will not be able to do this kind of great work in St. Cloud or in Duluth for the rest of the state. All of that work is contingent on us finding a critical new path forward for our medical school and our health system. So it is incredibly important work that we can completely do for the state of Minnesota that will be so important for the future of health all across the state. But I can't emphasize enough, this committee needs to understand it's all contingent on whether we can find a path forward appropriately in our next steps here. So thank you so much.
President Cunningham, we could not agree more, and we really hope that there's a resolution. I know you had, before you came on board with the U, there was an offer from Sanford, and that was rejected. So maybe that's someplace you'll return. I have no idea, but whenever you have an answer, we would love to hear that. Dr. Crawford, are you ready to continue?
Madam Chair, thank you. That concludes our overview of O&M funding for the medical school. With your permission, I'll now move on to the state specials. So to facilitate a discussion, we've broken down the single line appropriation found on line 224 of the spreadsheet dated May 30th, 2023, with a timestamp of 11:22 a.m. to show how the funding is distributed among the respective schools and colleges. I will address the appropriations allocated to the medical school, and my colleague, Ms. Nunnally, will provide an overview of the funding for the other schools and colleges. First, the St. Cloud Residency Program partnership with CentraCare. $346,000 each year is allocated to support up to 12 resident physicians in the St. Cloud Hospital Family Practice Residency Program. This program prepares physicians to practice primary care medicine in rural communities within the state. The legislature intends this program to improve health care in rural communities, provide affordable access to appropriate medical care, and manage the treatment of patients in a more cost-effective manner. The St. Cloud Family Medicine Residency is a perfect example of if you train them here, they will stay here. Many residents that train in St. Cloud either stay in St. Cloud, the surrounding area, or practice in rural Minnesota. The Rural Physician Associate Program, which is designated with the acronym RPAP, and the MetroPAP program. RPAP was founded in 1971, the MetroPAP program in 2010. RPAP was founded as a collaboration between the Minnesota Legislature and the University of Minnesota Medical School. The RPAP faculty designs, organizes, and oversees a 9-month clinical learning course for third-year medical students across Minnesota rural clinics and hospitals that fulfills a majority of the students' graduation requirements. The program encompasses multiple medical specialties, meeting student graduation requirements in family medicine, surgery, emergency medicine, psychiatry, pediatrics, and obstetrics and gynecology. 1,708 students have graduated from the program since its inception, with 285 graduating since 2015. Since 2015, the RPAP program has added 3 medical specialty clerkships to its portfolio, which include psychiatry, pediatrics, and OBGYN. Since its inception, proportionally, more RPAP graduates practice in the state in primary care, in family medicine, and rurally than non-RPAP graduates of the University of Minnesota Medical School. The next is the Biomedical Engineering Program, or what we call the Institute for Engineering and Medicine. Its mission is to advance healthcare through research partnerships between faculty in the health sciences, faculty in the College of Science and Engineering, and in the biomedical industry. Research collaborations aim to develop and innovate engineering solutions for the diagnosis, treatment, and prevention of disease. We are always looking to add new research themes as we add new members and research partners to the Institute for Engineering and Medicine. There are key components of STEM engagement, science, technology, engineering, and mathematics engagement into the learning population, into the student and school-age population through a program called Inspire that the Institute for Engineering and Medicine promotes. And this is a key corridor for the development of new investigators and teachers and ultimately practitioners of healthcare for Minnesotans. Next is the Regenerative Medicine Minnesota program, which is a collaborative partnership between the University of Minnesota and the Mayo Clinic to support regenerative medicine research, clinical translation, and commercialization. The Regenerative Medicine Minnesota program has awarded, since its inception in 2015, 173 grants to researchers and small businesses in Minnesota, allocating funding across key areas of research, clinical translation, and commercialization. These investments have driven groundbreaking innovations that have had impact on healthcare. The remainder of this appropriation for line 224 includes the Veterinary Diagnostic Laboratory, 2 for the health sciences research domains in 2 different collegiate units, and in dental care, and those will be covered by my colleague, Ms. Nonnelly. Madam Chair and committee members, during your previous work group sessions, we, along with our partners from the Mayo Clinic, presented on the Biotechnology and Medical Genomics Partnership, which corresponds to line 227 of the spreadsheet dated May 30th, 2023, with a timestamp of 11:22 a.m. Included in your packet is the follow-up information that was requested by the work group. For the benefit of the full committee, I will quickly recap. This appropriation is for the following activities. So annually, $7.991 million is allocated to direct and indirect expenses for collaborative research partnerships between the University of Minnesota and the Mayo Foundation for research in biotechnology and medical genomics. An annual report on the expenditures of these funds must be submitted and is submitted to the governor and to the chairs of the legislative committees responsible for higher education finance by June 30th of each fiscal year. $500,000 in each fiscal year, in fiscal year 24 and in fiscal year 25, so $500,000 each year, are to award competitive grants to conduct research into the prevention, the treatment, the underlying causes, and prospective cures for Alzheimer's disease and related causes of dementia. Madam Chair, that concludes my presentation. With your permission, I will now turn the rest of the state special allocations discussion to Ms. Nunnally.
Members, members, do you have any questions so far about the state specials under health sciences? Okay, seeing none, go ahead and continue. Thank you. Welcome to the committee. Please state your name for the record and continue with your testimony.
Good afternoon, Madam Chair and members of the committee. My name is Beth Nunnally. I serve as the Chief Financial Officer for the Office of Academic Clinical Affairs.
Thank you. Please continue with your testimony.
Pardon me?
I said thank you. Please continue with your testimony.
This slide pulls the writer language found on page 22, subdivision 5 of the bill language included in your packet titled Academic Health Center. And to facilitate the discussion, I'm going to pull this table, which is the breakdown of the single line appropriation from line 240 of the spreadsheet dated May 30th, 2023, with a timestamp of 11:22 a.m. This illustrates how the cigarette tax revenue allocates across the health sciences schools. I will be following up on the state specials in just a moment, but I'm going to start with the Healthcare Access Fund as the first category of funding. This is a total annual amount of funding of $2,157,000. This funding was received by the state to fund better access to health care, primarily primary health care, containing health care costs, and improving the quality of health care services to all Minnesotans. Of this total, approximately 44%, or $948,861, funds primary care education for our undergraduate medical students, and the remainder, $1,208,139, funds primary care resident education. These funds distribute primarily across the 4 primary care intensive departments in the medical school, including pediatrics, $1 million and $42,000, family medicine for $323,413, general internal medicine $285,008, OBGYN, $42,000, and the balance of approximately $450,000 is funding the departments of education that serve the Duluth campus, the Twin Cities campus, and soon to serve the St. Cloud campus. The funds are primarily used in the academic departments to pay for the teaching time of our clinical faculty. So the expenditures are predominantly salaries, fringe benefits, and the supplies and so forth that come along with teaching. And to the extent the funds go to the Department of Education or the Program of Education, they're funding costs such as stipends to rural physician residents who don't have another source of funding for their residency time. Other forms of residency support, trainings, orientation, recruitment, some salaries and fringe for the staff in that Department of Education that provides the infrastructure to support the residents in their training. And now I'm pleased to move on to the cigarette tax allocation, $22,250,000 per year. Again, the table breaks this out by each unit that serves the health sciences. First, the Office of Academic Affairs deploys about $3.6 million toward the Community University Healthcare Center in the Phillips neighborhood, toward our M Simulation Training Center and the new Health Sciences Education Center building that I'm sure many of you have toured by now, Masonic Cancer Center, our Center for Bioethics, and our Rural Health Program. Another $822,000 supports allied health programs, including occupational therapy, clinical laboratory science. It supports our Center for Interprofessional Education, which brings students from across all of the schools together and to train and learn and practice team-based care. And we also have a pre-health sciences advisory program and center that is supported with these funds. The School of Dentistry realizes $144,000 into its leadership budget. Approximately $14.8 million funds core medical school needs, faculty recruitments, and buying out clinical faculty time to help teach the students and the residents. The School of Nursing's allocation is $518,000. This allocation was primarily to expand the program to the Rochester community. In addition to the Rochester expansion, these funds are used to support nurse clinical operations, student training activities, the Center for Spirituality and Healing as another example. The College of Pharmacy receives $1.4 million a year. This funding, again, was initially to support the development of the program on the Duluth campus, and it continues to support the operations of that program in large part, 90%, with about 10% of this annual funding supporting the postgraduate pharmacy residency program. President Cunningham?
I'm just going to ask you a quick question.
Yeah.
So so the cigarette tax is not something that I see that's on our spreadsheet that flows through this committee, and I'm wondering if you could explain if I'm missing that, where that might be, but I'm looking at the spreadsheet and I know it pretty well, and I don't have a line item that I know of for cigarette tax. And okay, so we're going to go to my nonpartisan, so we're all on the same page. Mr. Savory.
Ma-
Mr. Savory, go ahead.
Madam Chair and members, current statute, which is 297F.10, requires that these proceeds be deposited in a special revenue fund account. So the bill that the committee would adopt, which is in subdivision 5 related to the omnibus appropriations, refers generally to general fund items, whereas this is a special revenue fund item that is credited to the university.
Okay, and Mr. Savory, is it on the fiscal spreadsheet that we've been using from Chapter 41? Do you know, does it have a line item there, or is it just in the language of the bill of Chapter 41?
Madam Chair and members, it is not on the spreadsheet because it's not a general fund item that it's budgeted for the omnibus bill. Typically, this falls under the tax statutes. So this is kind of in a higher education quasi-tax sort of special revenue fund account.
Okay, that helps. Thank you, Mr. Savory. Okay, so this is not something that we appropriate specifically through this committee, but we'll listen to the presentation either way. I know about the cigarette tax. It just doesn't land in this particular committee, but please tell us how you're using it nonetheless. Thank you so much.
Okay. You okay? Everybody okay? All right, so moving on from pharmacy and the Duluth campus, $360,000 supports College of Veterinary Medicine programming. About 75% of that is in the research area, the other 25% in the area of instruction. Another $450,000 distributes to the Rochester campus. And again, this was back, to the Governor Pawlenty era and the development of that campus when it was just being seeded. And that funding continues to support the Rochester infrastructure. I'll turn now back to the remaining state special allocations, and I'll just quickly pull this slide back up so you can be reminded of the numbers and how they allocate across the different units. You've heard about the first 3 initiatives already through the St. Cloud Residency Program. The School of Dentistry is appropriated $100,000 a year. They use this funding to support some of their collaboration in the Hibbing community with the University Hibbing kind of collaborative clinic operation. The The Office of Academic Clinical Affairs, $2.124 million, basically funds research in various of the programs in the Office of Academic Clinical Affairs, Masonic Cancer Center, Child and Adolescent Brain Health, at the Masonic Institute for the Developing Brain, our Office of Discovery and Translation, that is part of our Translational Science Institute, and Health Informatics Research. The largest single-line item in this state special portfolio is the Minnesota Regenerative Medicine Program allocation of $4,350,000 per year. And this committee, I believe, received the report, the most recent report, earlier this month. So there would be more details in that report, but we can provide whatever you want. And then finally, the veterinary diagnostic lab receives a total of $1.673 million each year. And this is really the statewide diagnostic, testing lab for Minnesota.
We have a question from Representative Liebling.
Thank you, Madam Chair. I just want to clarify, is that the same lab is that the lab that's shared with the Department of Health, or is this a completely different lab?
Ms. McNally.
It's a standalone lab on the St. Paul campus at the university.
All right.
If
separate
that
thing.
answers your question.
Yes, thank you.
Okay.
Okay, please continue.
In general, these funds, these resources that are so highly valued by all of our programs, they commingle with other streams of funding, philanthropy, sometimes clinical revenues, sometimes fee-for-service, operations, sometimes some tuition revenue to pay for a broad range of expenses. But compensation, obviously, is the dominant expense. It's, roughly 65% of the university at large, on average, expenditure. But again, there are university facility operations to be funded, equipment, supplies, and some of the programs which I highlighted. For instance, the Minnesota Regenerative Medicine Program and our Office of Discovery and Translation are really award programs, grant programs. So those dollars are flowing through to other parties, to support research proposals and other sorts of work that have been vetted through a competitive review process.
Thank you. I was just wondering since I haven't looked at the report yet since it's brand new, but if you could just let us know one or two of the top things of what you've discovered or what you've been able to move forward with regenerative medicine, and maybe the president knows, or if you do, that would be wonderful. Or Dr. Crawford looks like he might know. If he wants to come back up and just let us know some of the top line things that you've been able to move forward research-wise or discoveries. Or I remember about a decade ago, I had actually visited the regenerative medicine department, and it was quite interesting, but that's, a decade ago. So if you want to let us know what are some of the new great things that you're doing there. And I think we have somebody from Mayo here too, if you need a backup, because I did see somebody from Mayo here earlier. Dr. Crawford.
Thank you, Madam Chair, for the opportunity to discuss the Regenerative Medicine Minnesota program with you. As I mentioned before, since its launch in 2015, 173 grants to researchers and small businesses have been awarded through this program. These investments have driven groundbreaking innovations. For example, Regenerative Medicine Minnesota program has funded a company called Komodo Therapeutics, which is a University of Minnesota startup in developing gene editing therapies for rare and life-threatening genetic disorders. This funding has enabled critical studies on the efficacy, safety, dosing, and manufacturing steps, which are critical for developing clinical trials for ultimately novel cell-based therapies for conditions like mucopolysaccharidosis type 1, which is a devastating disease with limited treatment options. Another program through Regenerative Medicine Minnesota supported a Rochester-based Imanis Life Sciences in securing phase 1 and 2 SBIR, that's NIH small business funding, to develop platform technologies for cell therapies and regenerative medicine. Since receiving that funding in 2015, Imanis Life Sciences has expanded its highly skilled workforce and relocated to the Rochester Technology Campus, where demand for its oncolytic virology contract services continues to grow. Madam Chair.
President Cunningham?
If I may, Madam Chair, too, for the general awareness for the committee, the regenerative medicine, this field encompasses gene therapies, cell therapies, diagnostics, medical devices and tools, but really the underlying component is designed to repair or replace damaged organs, tissues, cells, and metabolic processes. For all of those that haven't done your bedtime reading on what regenerative medicine is, just to give you that little bit of background in addition to the incredibly technical information from my team. Thank you so much.
Thank you, President Cunningham. And I'm just wondering, so I know that you were working on that a decade ago to essentially grow parts and organs and things that that we all need, and I'm wondering, have you been successful in, what have you been successful in doing with the regenerative medicine money, which is $4.3 million per year?
Madam Chair, the list of the grant awards that is included with your materials gives you indeed a detailed list of each project and the allocation to each of those projects and what their goals are. As President Cunningham just articulated, the scope of regenerative medicine is broad in terms of the number of organ systems that are of relevance and impact. When we think about regenerative medicine, we think about opportunities to regenerate in the nervous system, the cardiovascular system, the musculoskeletal system, most notably. But additional opportunities emerge in the immune system, for example. And the immune system is recognized so importantly as required for harnessing and the ability to control and eradicate cancers. So the implications of the regenerative medicine program proceed into each of those domains. The one example that I gave, mucopolysaccharidosis, is a devastating disorder that is related to the inability to degrade the accumulation. You can imagine waste products that accumulate inside our cells, and if this process is not executed correctly, the ability of those cells to undergo their normal function is lost, and this has a devastating impact on connective tissues in the musculoskeletal system and growth, and then ultimately leads to a very premature death. So the opportunity to develop genetically modified approaches where we can insert adult stem cells, for example, cells that have been harvested from an adult, reprogrammed genetically, and then reintroduced in a way that can recover and regenerate the function of organs is a key example, a key prime example of an opportunity that the Regenerative Medicine Minnesota program has realized.
President Cunningham?
Madam Chair and members of the committee, I'll show you some of the things on the last page that my colleague here is referring to, but just a reminder, the way this sort of funding works is, so for example, the funding that goes to researchers in 2015 here for which has around cell therapies and regenerative medicine is then what develops the innovation and the technology, which then moves forward to become the company that is Amanus Life Sciences, now entering phase 1 and phase 2 of funding to have now expanded its workforce to relocate to the technology campus. So it takes multiple years from the original funding to move out. If we look at the types of things that we're funding in the past year here on the last sheet, in this past year in FY24, I can see a conglomeration of things that would lead to those sorts of then startup companies having the technology ready in 5-6 years going forward. So for example, ways to improve lung transplantation, ways to regenerate rotator cuffs, in case any of you have had any of those damaged. That kind of work that's being done now then develops that innovation and technologies and biomedical advances that then later goes on to become startup companies or cell therapies or biomedical startups in 3, 4, 5, 8, 10 years. That's the kind of pipeline. That foundational work that's done by this funding here then goes on to turn into that sort of eventual biomedical companies, innovations, life-saving therapies later on that then also fuel the economy. That's the pathway. Thank you.
Okay. Thank you, President Cunningham and Dr. Crawford. Please continue with your test. Oh, do we have another question? Representative Allen, thank you.
Thank you, Madam Chair. Just a real quick question on the College of Vet Medicine and the diagnostic lab. It's been around quite a while. I've toured it several times. It looks like it's showing its age, especially some of the equipment that's there. What exactly is the 1.6 million going towards within the lab there? Thank you.
Just bear with me for a second here.
Ms. President
Well-
Cunningham?
Yes, well, she's pulling up that specific information, which I do not have, and my colleague here may have, otherwise we can get for you later on. I'll just point out, our facilities on the St. Paul campus are all in a tremendous state of needing reinvestment. For this, we have HEPA requests in, which I understand is not this committee. However, we have a backlog of over $200 million a year and a total of $8 billion of backlog facility repairs that are needed across our campus. The St. Paul campus certainly shows up, including our veterinary school, as in bad need of additional funding and supplies and facility repairs. Funds like this, which may be able to help with, debt services, leases, and things like that are pointed out, are certainly not going to be able to address the backlog that we have in the actual buildings themselves that need repair, renovation, and reinvestment. I don't know if you have a
Yes,
specific
I do have an
answer.
answer for you, yeah. Looking back 10 years at the expenditures of the facility, 58% for personnel, student support, 26% for supplies and services, 13% for equipment, 3% other. But I'm sure the dean would agree with your observation of the state of the facility.
Welcome to the committee. Please state your name and continue with your testimony.
Madam Chair, members of the committee, my name is Annie Brannon. I'm the Chief Financial Officer for the College of Veterinary Medicine, and I'd like to just offer more information around that $1.6 million and how it is utilized in the college. So the $1.6 million primarily goes to support salaries of pathologists in the veterinary diagnostic lab, which permits us to maintain capacity to fulfill testing requirements for the state if and when there are surges such as high-path avian influenza, which we've all been hearing a lot about in the news. So we need to maintain a base level of capacity to both fulfill obligations for routine surveillance in addition to responding to and reacting to emerging pandemic threats.
Representative Allen? Okay, thank you.
Thank you.
Any other questions on the health sciences portion of the state specials? This is the time to ask if you're not quite sure what the money goes for, or if their presentation was too quick or too slow, or you have additional questions. Representative Liebling.
Thank you, Madam Chair. And, I'm new to this committee, so this is my first opportunity to kind of see how the higher education budget works. But as you know, I've been on the Health Committee for a long time, and it's really striking to me how, this is not anything about what the university is doing, but more about what we are doing with the way we organize our committees and the way our jurisdictions work. And I am confused by this budget. And we had good questions about the cigarette tax, for example. I think you asked the question, Madam Chair. And I think it's a very good, a good place to put a pin in it, that we do not see all of the relevant information in all of the relevant committees. We are quite fragmented around some of this stuff. And it's not hard to understand why. I mean, yes, it's all higher ed because it pertains to the University of Minnesota. On the other hand, when it's medical-related research, it also should go to the Health Committee, and it doesn't always. A lot of these initiatives, regenerative health initiative, for example, I'm pretty sure did not come to the Health Committee. I'm not sure why that is, but I think we should maybe give some serious thought to lining things up a little better so that we all get a better picture of where money is coming from and where it is going. And I really appreciate this presentation and hearing about this, but I do admit that I am feeling a little confused about the whole thing. So it's good for me. I'm hearing it as a newcomer, first time through, But just want to say that even though I've been around the legislature a while, I am finding this very confusing. And usually that tells me something about the fact that it is confusing.
Representative Liebling, I could not agree more. I am very, very grateful that you are on this committee. You bring a special expertise, and I don't know why you've never landed on the higher ed committee before, but I am very grateful that you are here. And I feel like I'm in the same position. And here's my understanding after being on and off this committee close to a decade. This is the first time we've had a presentation about some of the riders and the state specials underneath the University of Minnesota. And do they go to your committees? I don't think so. And you've been here a very long time, which I am very appreciative for that long-lived expertise. So yes, they should come and present, even though they are special riders and special appropriations that come through this committee, but they are funding things that are way beyond the expertise of this committee, which is kind of what we're getting at. So that's why I kept asking about the regenerative medicine, even though a decade ago I went and I toured and I spent many, many, many hours there trying to understand the research. And I could tell you some of it when I was there, but I wanted to know, well, we've been giving a substantial amount of money, Representative Liebling, $2.3 million per year for this type of research. And I wanted to know something that my mind, that's not a health specialist, I'm not a doctor, and I haven't had the expertise that you had, that's something that I could grasp and say, okay, now I understand what we've used the money for. And I am also confused. So I appreciate you saying that, because all of these things are things that are new to the whole committee, because we frankly haven't talked about them before. And I don't think they have gone to your committees. Yep, Representative Cleburne. Or do you have more? Yeah, Representative Liebling.
And thank you, Madam Chair. I really appreciate that and look forward to working with you on it. And one thing I would note, I think I heard when the legislation was read here about regenerative medicine, the reports do not go to the health committee chairs.
Yes, Representative Liebling, that is correct. And they came to us about a month ago. And, we were all rather busy a month ago, but I will get to that and have a look at it. But I don't know that I have the expertise to understand it as well. It was very technical in the presentation. And again, very glad that you're here and hoping that you're capturing some of that and can have some of that understanding. But yes, these are significant dollar amounts that go through this committee as either a state special or as a rider. And so that is why we're having this conversation. And thank you so much for kind of sharing my page of trying to understand all of this. Representative Cleburne, now to you.
Thank you very much, Madam Chair. And I think we have to be really careful with any of the state specials and the riders that we have. And maybe it would be a good idea, and maybe something we could think about going forward, is when we have presentations such as this with the state specials, to have both the Health Committee and the Higher Ed Committee meet together and go through them together so that there's a better understanding and collaboration. We don't have jurisdiction over this account it's a special revenue fund, is that correct? Mr. Savory?
Mr. Savory.
Madam Chair and members, if you're referring to the tax revenue piece, yes, that is, I believe that's tax statute.
Okay.
Yeah, so the cigarette tax portion, but
Right.
everything else is actually in our jurisdiction, and they appear on the spreadsheet, which is why, I've beaten to death the spreadsheet, and yet we're still confused, right? So, yeah, so this is underneath the state specials appropriations and riders underneath the University of Minnesota section of the spreadsheet from Chapter 41, which is the latest appropriations that we have. Representative Cleburne.
Thank you. And I would think if we were to go through these, I think it would be important that we do it in conjunction. If we're going to review and say what is necessary and what is not necessary in these special accounts, that we do so in collaboration with the commissioners over those departments, with the committee members of the other departments, because, I'm of the philosophy of do no harm, right? But also to share the good news of the work that the university is doing in all of these areas, right? So having removed, let's say, in the ag specials, which is not the topic for today, but having removed the professors and having put them in a GREET, and that's in the ag committee, there are lots of pieces that are spread out through different committees. So if we're going to go into those writers or into those special accounts, I would think it'd be very important that we have all the people interested in the room at the same time. Thank you.
Thank you, Representative Claiborne. And you are talking, when you talk about the ag and the extensions, it's $85 million in the biennium. So that's a significant amount of money that it's the largest of all of the riders and the special appropriation. So I appreciate that conversation, Representative Claiborne.
Thank you, Madam Chair. And without the expertise of some of the members that serve on ag, I would be very nervous about us touching those without really knowing what we're touching. So thank you.
Thank you, Representative Claiborne. Yes, so we do have people from variety of committees on here, but I would not want to put all of this on Representative Liebling or Representative Noor's head. That's just unfair, even though they have expertise in those areas. You know, we have some things that come through that is specific to public safety, and we happen to have the public safety chair here. So we have some expertise, but it does feel rather disjointed. And so as I've been trying to struggle through this and understand it myself, you're feeling my pain, Representative Liebling. So thank you for sharing in the pain. So this is no disparage against the university. This is just the first time that we've had this opportunity to have this conversation. Some of us are completely new to the legislature. Some of us are new to this committee, as is Representative Liebling, who has been here for a very long time and has great expertise in the areas of health. And so, again, very grateful that you're here. But nonetheless, this is all new to us, and we're trying to digest all of these particular, you have a lot of special appropriations and special riders in our spreadsheet. So we're doing the best we can to understand what's been given and what you've used it for. Yes, Representative Liebling.
Madam Chair, thank you. And I guess what I'd like to ask the university, I mean, I know that probably from the point of view of the university, some of this, it's good to have these dedicated pots of funding that continue from year to year. I'm sure that is a great thing, but I think maybe the flip side of that is that you're kind of constrained in your flexibility to use funding, right? I mean, a lot of this is dedicated here, there, and everywhere. And maybe not today, but I'm kind of interested in knowing if some of these constraints, you know, especially as the federal funding picture is shifting, that maybe what you need is more flexibility to shift some of these funds around. And so I hope that as we, you know, go forward here, that you'll let us know if you know, it looks like I've struck a chord there.
Thank you, Representative Liebling. I've had that same thought, that maybe more flexibility is better than being so prescriptive. And I know the legislature has given you gifts throughout the years, and this is a result of many legislative gifts, and long precedes, you're brand new to Minnesota, so welcome again, but we tend to silo things, as you can see, and there's lots of gifts from the legislature. So I had thought also about giving more flexibility as they are trying to construct and react to a changing landscape. I'm going to go back to Dr. Cunningham.
Madam Chair, Representative, so first of all, fascinating, and I'll just say, you know, we're delighted for the state partnership and view it as a deep partnership, and are happy to partner and to present these line items and these riders in any way that the committee would like to see them. There's obviously tremendous impact in any one of these line items that are certainly ongoing impact that we continue to provide, whether it be from the great medical advances from regenerative medicine to, you know, the personnel in the vet lab that are currently examining the latest surveillance needed for avian flu. So these are real funds that are doing real work in our community. To your question, Representative, I'm sure my finance person, without turning around, would be delighted to have the most flexibility in all the funding. However, I will also say when we have flexibility and we have flat budgets or no budgets, then that's not really flexibility, in which case it's better to have it designated. So I would like to have it in whatever way we actually do get the funds so that we can keep doing the good work that we're doing. And, you know, I've heard both things since I got here, which is we would like more understanding of line item accountability, and we're happy to do that if that's what makes the comfort for the partnership more. Obviously, more flexibility when there are shifting times and shifting landscapes is helpful. So somehow, if you can accomplish both of those hat tricks, we're happy to deliver then reporting on however it would like to be done. Thank you.
Thank you, President Cunningham. I think we're looking at, over the many years that the gifts of the legislature has given you special appropriations, special riders, which ones have been the most effective? And we're kind of in a budget difficult year because we don't have the forecast yet, but the forecast probably is not going to be fantastic, and then the tails are even worse. So we're trying to balance everything and have a full understanding of each of these special riders and appropriations so that, we know what are the most valuable, the most important, the most successful, the most productive things that we want to focus on. And I think that's sort of the hope of the committee. Yep, Representative Cleburne.
Thank you. Madam Chair, I appreciate where you're going and what you're trying to accomplish, right? Making sure that every dollar allocated to the resource is doing the best work for Minnesotans at the time. However, when you get into long-term research, right, it looks like nothing, looks like nothing, looks like nothing, and then boom. And sometimes it is actually decades before we hit that aha moment. And I want us to be really careful when talking about academic research that we are not short-sighted and that we allow the scientists who are actually doing the work to help us understand the need and the importance, right? I mean, CRISPR was nothing until CRISPR was everything, right? And so we want to be really careful not to dabble in affairs that we're not knowledgeable in. And so we can actually do harm to long-term projects that we have invested a great deal of money in if we truly don't understand the work that's happening. And that's why we have scientists. That's why we have the university. That's why we have deans to help us understand what direction we should go. I mean, nobody thought soybeans were anything except animal feed until they were something else. So, I mean, we have to be really, really careful when mucking with these specials. And that's just my precautionary statement. Thank you.
Thank you, Representative Cleburne. Yes, some of them are research, but there's a lot of things in here. So as you were listening, they fund all kinds of different things. And we talked a lot about the research because it was something that was a larger appropriation and it was something of interest. And strangely enough, I had gone to visit that particular part of research a decade ago. But yes, I understand what you're saying. And there's a lot more in the specials and the riders than just research. So thank you for that. Okay, back to the presentation. We have about a half an hour or so, and thank you for giving us this flexibility to kind of grapple with you and try to understand what these specials are and what they do. So please
Madam
continue
Chair
with your
and members of the
presentation.
committee, before I turn the rest of the presentation over to Amy Pittinger, my colleague, I'm asked to call your attention to two mandated reports that are in your folder. One is the current use of funds report, and the other is the evidence in support of request report. Thank you for your time.
Thanks so much.
So President Kenningham, are these the two at the very end of the packet that you provided? You said it was evidence in support of appropriations report and an annual report to the legislature, use of state appropriations for the benefit of health science colleges and schools? Are those the two reports that were being pointed to?
Yes.
Yes, okay. Thank you, Ms. Tonneson back there. Okay, now please state your name for the record and continue with your testimony.
So, Madam Chair and members, thank you for having us here today. For the record, my name is Amy Pittinger, and I am the interim dean for the College of Pharmacy at the University of Minnesota. Pleased to share with you quickly our health sciences strategic plan, which informed the legislative request. The President, in her opening comments, talked about our commitment to health and the future workforce. This is our vision for how we will act on that commitment. Through education, innovation, accessible care, and partnerships, we are committed to improving health statewide. The University of Minnesota stands apart as one of only 4 U.S. universities housing all 6 health sciences schools: medicine, nursing, pharmacy, dentistry, public health, and veterinary medicine. And this breadth allows us to lead in human, animal, and public health. With campuses in the Twin Cities, Duluth, Rochester, and soon St. Cloud, we collaborate across disciplines, including science, engineering, public affairs, business, and agriculture, to drive impactful solutions. Our graduates understand the deep connection between physical and mental health, human and animal health, the health of people and our planet. Through this interdisciplinary approach, we ensure the highest quality education, research, and care for all Minnesotans. Our shared goal is to ensure that all Minnesotans have access to exceptional health care. We will achieve this goal by expanding access, by reducing health workforce shortages statewide, reducing health inequities by expanding partnerships to reach rural and other underserved communities, improving healthcare quality close to home, and transforming health outcomes through innovation in prevention, treatment, and care models. Madam Chair and members of the committee, we know that finances are tight, but Minnesota faces an urgent healthcare crisis. Critical workforce shortages, deepening health inequities, and limited access to quality of care, especially in rural and underserved communities. The University of Minnesota plays a unique and vital role in addressing these challenges, training 70% of the state's health professionals. But without immediate investment, the gap between demand and available providers will only grow. With $22 million, we will expand the health workforce, training an additional 240 doctors, 200 veterinarians, 650 nurses, 400 public health practitioners, 800 patient care specialists, 240 pharmacists, and 200 oral health professionals, and 250 other health professionals, including occupational therapy and medical laboratory sciences, over the next decade. This investment is not just about education, it's about ensuring that Minnesotans have access to skilled providers when and where they need them. To reduce health inequities, we're requesting $5 million to strengthen partnerships in rural and underserved communities where healthcare is the most fragile. Evidence shows that providers trained in these communities are more likely to stay and serve there. By expanding these programs, we ensure high-quality care reaches every corner of our state. Minnesotans also need better health care closer to home. With $8 million, we improve care availability and quality, addressing the reality that too many Minnesotans lack timely, essential services. Through direct care, education, and collaboration with local providers, we will close these gaps and deliver the right care at the right time. Finally, as Minnesota's leading research engine, the university drives medical breakthroughs that save lives. With $10 million, we will launch targeted, multidisciplinary research into prevention, treatment, and care models for high-need conditions, determined in collaboration with the state. These funds will also ensure that cutting-edge discoveries will move swiftly from research labs into real-world practice. This investment is not just a request, it is a necessity. Minnesota's healthcare future depends on a bold action now. We urge you to support this funding to expand access, reduce inequities, improve care, and drive life-saving innovation for all Minnesotans. Madam Chair and members of the committee, this concludes our presentation. Thank you for your time and attention.
Thank you. Representative Allen.
Thank you, Madam Chair. Just had a real quick question here, just trying to understand exactly how dollars flow with at the University of Minnesota the University of Minnesota the state to the University of Minnesota. And specifically, when the state allocates money for the University of Minnesota Medical School, does that money flow directly into the medical school? Does it go into the general fund? Is it allocated back over in central administration? Could you kind of walk me through that process?
Looks like Ms. Tonneson is coming up. Welcome to the committee. Please state your name for the record and then continue with your answer.
Madam Chair, Representative, if we go back to Thursday a little bit and get into this, there's the O&M appropriation and the state specials. The state specials and the riders.
If you could state your name,
I'm
please.
sorry, Julie Tonneson, Budget Director for the University of Minnesota. The state specials and the riders are designated in law, and so they come to the university. I mean, technically, yes, they come into a central account, but are automatically in the dollar amounts appropriated. then distributed directly to, in this case, the medical school's accounts. The O&M appropriation comes in centrally, but is then part of that base plus minus budget process that we talked about last Thursday. And every school, in this case, the medical school, has a base, and we annually determine increases and decreases to that base based on how much money we have available and the other revenues and the process that we go through and so forth.
If I may, Madam Chair.
President Cunningham.
Madam Chair and representative and members of the committee, one of the things we did different in this year's budget, which is partly out of the learning that my team did last year and that I did when we first came in, is we heard that the state and committees would like more segmentation that would be more clear on where the funds are that we could be going, so we could be more clear that things are not just in a black box, but when allocated. So for example, this request, if allocated, would be allocated exactly to these things, not to our general budget that then would be, confusingly put everywhere else, right? So we have 3 of these special buckets this year, in addition to our general O&M ask. We have a special request around student success, a special request around research and discovery, and a special request around health. And if allocated in this amount, we would then be accountable for delivering exactly what we're saying here back to the state in that partnership.
Representative Allen.
Thank you, Madam Chair. Yeah, as I've talked to other people, that's been kind of the number one fear that they have, is the dollars aren't necessarily getting over to the particular or group that you're trying to be able to help or get with research or whatever it may be, and actually knowing where that goes. So I appreciate that answer. Thank you.
Yeah, Madam Chair, Representative, this is not a shell game. We are very committed to providing the exact requests that we have here and be delighted to report back. That does indeed, as was mentioned before, give us less flexibility. However, we also think that the partnership and accountability is important. This is an important, and all 3 topics that we chose to have special components on, we feel are very important for the state. And so providing exactly what we could do with this kind of clarity with these exact funds, we thought would be important in our partnership. And then we would be delighted to come back to you in future years and report how this has indeed impacted healthcare workforce for the state.
Representative Robbins.
Thank you, Madam Chair. Thank you, President Cunningham, and everyone for the excellent presentation. Sorry, I didn't have my mic on. So I'd like to go back and ask another question about the Fairview Essentia Medical School situation. This has been an issue of great concern to me for the time I've served on this committee. We watched last year or 2 years ago as the Sanford deal fell apart, had robust conversations with people at the U, and not you, this predates you, but I just want to give you the history and perspective. And the U walked away from that deal, which I think would have been beneficial and would have provided a lot of financial stability. Now Fairview is walking away, and I know we're not privy to the numbers, but I have concern that that won't be enough. Those 2 partners, you and Essentia together, won't be enough to provide the stability the finances need. And if I'm wrong, I would love to see some data on that. And then secondly, related to that, I know you say that the $1 billion that they asked the state to provide to buy those medical buildings a couple years ago, now the U is going to fund without state money, but I mean, money is fungible. So can you explain to me where that $1 billion is coming from out of your budget? That would be great. Thank
Absolutely.
you.
President Cunningham.
Yeah, Madam Chair and representative and members of the committee. So 2 pieces. There is no deal here without all the assets together of Essentia and of Fairview. You're 100% right. It is not possible for us to do this with Essentia alone. The scale of the operations is not enough to support the clinical operations needed to support. I mean, you'll notice here, the state overwhelmingly is not funding medical education and research. It is funding some, and we are very grateful for that. But overwhelmingly, academic medical schools are funded by the clinical system. That is true across the country. All academic health medical schools have clinical system partners for which their academic physicians practice in, and then for which there is funds flow. That funds flow is not a gift. It is not a donation. It is a partnership with the brand and the excellent quaternary care that an academic physicians provide. And then with that is a partnership of those funds. Most places across the country, that's in an integrated model. The places where it's moving, the more modern places in the country, it's moving to an integrated where it is not us doing this and then the hospital partner giving back why, but is what we are proposing here, which is a new integrated system in which it's all generated in-house and then supports the medical operations and the medical education. So that's what we're trying to move towards, away from a transactional approach, which is what we decided to do here in the 1990s, which a lot of places were doing in the 1990s, but it's 2025. And the rest of the country, great medical schools around the country, Hopkins, Penn, Penn State, Duke, Emory, the California academic systems, Illinois, are moving to integrated academic models like the one we are proposing here as a path forward. But with that, you need scale to the operation. The Essentia and our path here is not an Essentia and university-only path. First of all, we have care and education here in the Twin Cities. So it needs to be an all-in partnership. We believe, and the Sanford part was before my time, but I will say like all things that potentially fall apart, there were kernels of good ideas in that. And the kernel of the good idea within that Sanford deal is that was going to bring money into the system. It was going to bring $500 million in to recapitalize these buildings, which, by the way, are not university buildings. They are owned by the Fairview Health System, which have been undercapitalized. I encourage the committee to take a walk. Undercapitalized by $500 million. Where we're asking our nurses and our physicians to provide excellent care right now for patients. That Sanford deal was going to bring $500 million forward, and it was going to provide access across a more rural part of the state in a broader way. Those were two really good ideas. Before my time, for reasons you are more familiar with than I am, that fell apart. But there are kernels to that good idea, which we're trying to bring to that now. The Essentia pathway would have us, again, provide care across rural Minnesota in an integrated fashion. And it would bring $1 billion to the system, not $500 million. So twice as much as what the group was willing to do 2 years ago, we're bringing to the system now as a potential. Let me ask, well, I'll tell you where that's coming from.
Okay,
I know that's what you want. So where that comes from is a combination of current university debt capacity and the debt capacity that would be extended by Essentia's debt capacity. Those together, along with some philanthropy, but mostly with that debt capacity, would then go into being able to recapitalize the system and bring that money to bear on a new integrated system. The thing that's different, though, is those funds would then be paid back by the clinical system operations revenue, which is how all excellent large healthcare systems work. So they would then not be the responsibility of the university to be able to certainly would not be coming from tuition dollars, would not be coming from our departments, would be then debt capacity that is paid back by a well-functioning, high-performing clinical health system, which we believe and have modeled that can move towards. Does that answer your question, Representative?
It does. Thank you very much. And thank you for that larger explanation. It's honestly one of the best answers I've ever heard on this question, so thank you very much.
Thank you. May I add one thing, Madam Chair?
President Cunningham.
One of the alternatives that was floated last year, which was around a transaction to buy buildings back, that would leave the university completely strapped.
Exactly.
That would be an option that would require us to come up with funds, more funds than we have, and would not have a clinical system to help support the payback of those funds. And so, this new other opportunity provides many more benefits for the state than that other solution. Thank you for the time.
Representative Robbins?
Just one more follow-up. So just to be clear, the debt capacity would be from the U and Essentia, but not include Fairview.
President Cunningham?
Yeah, Madam Chair, Representative. So that is the plan, right? So eventually, all the assets and all the debt of both of those systems would come together. But we have the financial proposition we have in front of us is our debt capacity combined with what we would have an extended debt capacity of Essentia, as well as Essentia is a profitable system. one of the most profitable in the state currently, running at excellent margins, that with their debt capacity, with our combined, with the debt capacity we could bring to bear would provide that. So yes, it's a solution for the current Fairview facilities and buildings that they have not been able to provide to the facilities that our physicians and nurses and patients are being cared for, that we would be bringing to them. That would be then part of one system. But of course, we need partnership and we need great leaders to think about the future of health of the state.
Thank you, Madam. Thank you, Madam Chair.
Okay, great. So just a really quick question, because this is something that we've been talking in this committee about for a couple years now, I believe, Representative Robbins. And so early on, when we first started having this conversation, and there was a conversation about purchasing the buildings, which would have been a huge endeavor, very expensive, huge endeavor, and I believe there was at least concern here at the state that we were going to be asked to buy those buildings on behalf of you, in full or in part. And the situation that that you're in now is that that the system wasn't profitable. And that was the conversation that we'd had for several years, that there wasn't a good profitability model at that point. And now you're encouraging us, I think, by saying that you've got a model that will move forward that will be profitable, and that if you're going to be incurring this debt, both you and Essentia, that it can be paid back because you'll be turning that ship around and making it profitable. So I appreciate hearing that. That's the first time I've heard that. The only thing I heard in the past that I recall was, well, the state's going to have to help pay for many things. President Cunningham.
Madam Chair, we're very conscious that the financial condition certainly of the state, and we have base requests for you, which we very much need to continue to expand our great university. But I have been focused on looking at solutions that we can bring to the state that don't require you to fund the building purchases or necessarily then bail out whoever it is hasn't funded those to date properly for the conditions that they're in. So what we're doing is looking at trying to come to a solution for the health, and we believe this solution has one opportunity that will expand rural health care, that will expand our workforce capacity, and the alternative solution is really not anywhere near, has real consequences. I just want to say, this is not a matter of two businesses that kind of can't agree with nobody else's health outcomes at stake. There are two very different health outcomes at stake here for the state of Minnesota. And what we're trying to do is to present both of those and then work towards a really good solution that everybody can get behind.
Thank you, President Cunningham. Representative Noor.
Thank you, Madam Chair. Thank you so much, Madam President, for that explanation. I just wanted to understand better the facilities where we're caring for patients, where physicians are working, where frontline workers are working right now, knowing that the conditions that they're in, what is included in that package? The West Bank and the East Bank within the University of Minnesota. What is included in that? At the same time, will there be a request for HIPAA? Because we don't want to leave that one out.
Right.
So that we are ready and prepared, because we need to make sure that those facilities are in excellent shape to provide the care that we need for those patients.
President Cunningham.
Madam Chair, Representative, you just hit on a key point of confusion for many people. The East Bank and West Bank facilities are not owned by the university and are not state facilities. They're owned by Fairview Health Services, who has not invested in them adequately and has chosen to invest in other parts of their system differentially, where we now have estimates between $300 and $500 million of deferred costs in those four buildings. We are asking, our leading academic nurses, techs, and staff to provide care, which we believe is excellent care, but it is a lot less efficient and difficult for them to provide that care in facilities that are not at the level that one would expect of an excellent academic center. And also, as we look to train what is the workforce, as I mentioned, for the state of Minnesota, that workforce certainly deserves to be trained in facilities that are going to be modern and going to leave them well-positioned to live and work wherever they're going to be in the state. So there will not be HIPAA requests because they are not our buildings. So we can't control them, and we can't control how they get fixed up unless we find this solution. And this solution, which we're proposing here, would indeed bring in those assets of those buildings as well as the rest of the Fairview system with the Essentia system, and then the $1 billion that we're talking about in debt capacity, some of that indeed would go towards fixing those buildings up, which we believe is essential and what the people that we're working for every day to train deserve as they go to work every day to take care of some of the sickest patients in the state.
Representative Noor.
Thank you, Madam Chair and Madam President. I think for guiding us into what is going to come next. I know in this committee, we've also talked about the capital investment request from the University of Minnesota, although it's not in our jurisdiction. It has become normal for us to really understand the needs of the University of Minnesota in a global way. I'm hoping that we'll get that presentation of what capital investment request will be coming before us.
Thank you, Representative Noor. Yes, so that is newish. Chair Pulowski felt that was important, and so he did bring that forward. And I guess I've heard it sporadically throughout the years as well, but certainly Chair Pulowski was very interested in that, and so we got to hear it at that point. And I believe our intention is to do that as well. I've encouraged the two major systems to come and present that as well. And to be honest with you, the other system would be happy with $25 million to just demolish some buildings, strangely enough, because they have $1.7 billion of deferred maintenance. And I heard you had even more. So was it 5 or 7 billion?
Madam Chair, Representative, we have five, I'm being corrected. Okay. Thank you for calling a friend. We have $5 billion in deferred maintenance. I believe our request for HEPR this year is $200 million. Some of that we would use to demolish buildings that absolutely need to be taken down, but we can't take some of those down without the funds to do it.
I hear you, and the other system said the exact same thing, but we'll have those conversations moving forward too. Lead Wolgamont.
Thank you, Madam Chair. Madam President, I just wanted to follow up and clarify from in a response you gave to my previous question, continuing on our theme of medical schools here. Madam President, I believe that you had said that the St. Cloud and Duluth medical schools couldn't continue without a resolution. Now, could you please kind of elaborate on that or clarify what you meant by that? Thank you, Madam Chair.
President Cunningham.
Madam Chair, Representative, so we have one medical school that has multiple sites. One of those sites is in St. Cloud. One of those sites is just starting in St. Cloud, and one of those sites has been established in Duluth and is recently working to expand in Duluth to 4 years. Both of those, as was mentioned in this committee, are excellent opportunities to train physicians where we hope that they will practice, and we know the best way to get them to practice across rural and greater Minnesota is to have them trained close to where that is. But we have an existential crisis with this contract that we're talking about. And if that existential crisis is not solved in a way that we don't have a devastating financial picture for the only medical school we have that has multiple sites, we will surely not be able to continue the kind of expansion that we have in St. Cloud or in Duluth. We will likely have to constrict on all fronts, and that would make us less able to do the kind of good work we need to do across rural Minnesota, which is why I would ask that it's in the broad public interest to pay attention to the outcome of how we're negotiating what this existential solution is for the medical school right now in our contract negotiations, because the impacts of that will have effects not only here on these 4 buildings on East and West Bank, but will have tremendous impact in how we can continue the great work and expansion we're doing across the rest of the state.
Representative Wolgamont.
Well, thank you, Madam Chair, and thank you, Madam President. That is the first that I had heard of those being linked, so I appreciate you sharing that with the committee and with the public. And I know how vital and crucial the St. Cloud Medical School is to my community and to my constituents, so it's in our interest to continue to communicate with you and make sure that we're getting all the information we need as we strive to move forward. So thank you for that answer, Madam President, and thank you for letting me ask the question, Madam Chair.
Very good. Representative Allen.
Thank you, Madam Chair. I'm kind of a research nerd, so forgive me. I was just kind of looking through some of the stuff here from the University of Minnesota and Mayo where there was joint funding that was taken care of. Thinking back to kind of some of the other things that the University of Minnesota does, it typically has a tendency to patent some of the things that they do. As I was looking through with the Mayo stuff, FY24, line 142, you have a disruptive ultrasound hearing aid technology, prototype development, and usability tolerability testing. There's several things like that where there's testing of particular items and whatnot. Does the University of Minnesota hold like a joint patent on some of the things that are being developed at Mayo?
President Cunningham.
Madam Chair, Representative, I can probably answer that generally and then get you specific information. So the way patents work, and the university is the largest producer of small startup businesses that come predominantly not only from MedTech, but a lot from MedTech, which comes from the general work that we are funded from across higher education. When researchers begin to do the work, and I'll give you a hypothetical here on the Mayo situation, and then we would have to follow up with specifics. As researchers develop any innovative technology, they then move through our very excellent a commercialization office at the university and move to patent that. As they patent that, then that technology can move out into the public, either in small startup businesses or be taken over by larger businesses. That the patent and the original rights to the IP is shared by the investigators, no matter where they are that have created it. So if it was created jointly by a Mayo and a University of Minnesota person, then that would be patented and shared across, typically proportionally to the knowledge that was contributed at the time, et cetera. That's a general answer from my prior Vice President of Research days, but still applies here. And I imagine anything that's coming out of Mayo and the university would have shared IP.
Representative Allen.
That's kind of what I was wondering, and if you happen to have that data or that information, I'd really appreciate it. The other question I had for you was going back to the presentation you guys gave back here the other day. It was on slide deck number 5 of the University of Minnesota budget overview and state funding, specifically around some of the framework with the funds that you had coming in to be able to fund the university. I think you had 11 total places funds were coming from. The indirect cost recovery would have been number 8 in terms of how much money was coming in, which made up about 5% of the incoming dollars. You said federal reimbursement was a percentage of that. Could you give us a breakdown? I know you probably don't have it here with you right now, and that's understandable, but could you get our committee a breakdown of exactly what percent of that indirect cost recovery is that comes from the federal, from private entities that are hiring you guys to do research for them, either in the pharmaceutical side of it or medical field or that kind of thing? I know I've saw several research trials the university does on a regular basis for either fertilizer companies, chemical companies, feed nutrition companies, that they hire the University of Minnesota to do, and it would just be interesting to see what that breakdown is. We don't necessarily have to have every single one, just kind of a general idea, so.
Madam Chair, Representative, we can get you the breakdown. You're right, we do receive research from a wide variety of sources. And I think the highlight point from that last week would be our largest source of research funding is from the federal government. And so with that, that would be then the largest impact around that. And those rates do vary, but one of the reasons those rates are able to vary for the indirect rate across different sources is because we do have the federal indirect cost rate to be able to support some of the facilities and things like that, which then actually supports our ability to do work with businesses or work with private, either foundations or private industry, because we have other of the costs managed through the overhead rate more broadly. But we can get you the breakdown of the by source and by amount. I want to say it's more than 50% federal government. Yeah, maybe 80% federal government, but I'll have to get you the exact number.
Thank you, President Cunningham. I remember, before we were official and you had this wonderful slide, and maybe you could send that to us again. But it did break down how much was coming from NIH, DOD, DOE, state appropriations. So outside of this committee, there's about, in a given year, it's between 90 to 100 million, and it's usually through some of the legacy dollars and some other things where it's direct research to the U. So, in fact, I believe I asked our nonpartisan fiscal to put that spreadsheet together for me at one point. So I know that it was at least 90, and into some years it's 100 million outside of this budget area. So there's money coming from all different directions for that. Okay, so as I was looking at the spreadsheet, I just have one final question before we kind of wrap up. We've got just a few minutes left. And one thing that I don't think you've touched on, and I'm wondering if you're going to on Thursday, is Min Drive. That is one, okay, so that's coming on Thursday. So I'm just going to assume then, so some of the line items that hadn't been touched on will be touched on Thursday. Okay, wonderful. Because there's a great interest here. Again, this is something that we haven't had before. We're doing the best we can to digest everything that you're talking about. And I would ask too that, our spreadsheet that we had, which is what closed out on chapter 41, is kind of our guide, so we know where you're at. So if you just, throughout the presentation today, you were referencing, well, it's on line item 200, or it's on line. And so that's very helpful for us, so we can kind of quickly see, oh, okay, so that's where it is on our spreadsheet, and we kind of can tie all those things together. So that was really helpful if you would continue to do that. If there aren't any other questions, I'm not seeing any, we will adjourn for today. We'll see you Thursday. And I have to say, President Cunningham, that it was a joy to have you. And thank you. It is, what a difference a president makes, and we are very grateful for your presence here in Minnesota. We are adjourned.
Thank you to my team. Thank you.